And thanks so much for joining us tonight. Well, it's something the Kennedy Miller case highlighted, the need for an improved intake system when it comes to taking referrals about child abuse and neglect. And according to WCHS officials, they're now in the process of putting in a new system. Anna Saunders joins us live in the studio tonight to explain. Anna?
Gina, with the child abuse and neglect intake system that's in place now, if a call or accusation does not reach the level that would require a criminal investigation, that is where the road ends. What this intends to do is to give multiple pathways for families for supports before it gets to a point where it becomes a case of abuse or neglect. The West Virginia Department of Human Services announced this week it is partnering with a nonprofit called Evident to create a new intake tool when dealing with abuse and neglect cases that will allow to help or refer cases on to other services when it may not reach the threshold of abuse or neglect. It's something the West Virginia Center on Budget and Policy Executive Director Kelly Allen said was needed in a 2023 report.
The only options under the current system, as I understand them, are investigation or nothing. So this alternative pathway is really important because families can be connected with supports.
This was a need that the Kennedy Miller case highlighted. A year before she was found dead, apparently starved in her Boone County home, state troopers visited her for a welfare check. While she seemed physically okay then, they did have concerns about her mental health. But state officials, including WCHS Cabinet Secretary Cynthia Persilli, told us in a June briefing that it did not reach the threshold of abuse or neglect.
If they don't meet that statutory requirement, we have only the option at this point to screen them out.
She said then that the department was working on developing a system where people who do intake can better assist families or children who might not be in an abuse or neglect situation get access to help with things like mental health, food, and bills.
There is this middle area, and I will tell you that most often that's related to poverty, and we do not equate poverty with abuse and neglect, but there is this middle area. And so what we will undertake is the referral of those cases to additional supports.
While the exact mechanics of how this new system will work were not given in the announcement, it did say a series of evidence-based assessments will be used to evaluate a family and child situation rather than just the abuse or neglect threshold.
Really am hopeful that this will result in more kids being able to safely stay with their families and kind of bypass and get through those times of economic hardship or substance use treatment, kind of get over those humps of getting the supports that they need.
Now, WCHS staff is doing a kickoff training event this week with the new system, but full implementation is supposed to take place in January 2026. I did ask WCHS about the cost of implementation. At this time, I have not heard back. Live in the studio, Anna Saunders, Eyewitness News.
Thanks for watching. Here's another video from Eyewitness News. And click here to subscribe to our channel to get the latest.